in regards to feasibility and our ability to move forward are going to be dictated both by the logistics and both by current health conditions. And I think that we're all excited to hear from Dr. Urbina and Jeff in regards to where we are in Boulder County. I know the board certainly has some questions. And so at this point, Jeff, I'd love to turn it back over to you.
Thanks, Rob, and thanks, board members. So what I'll do is share my screen here. Make sure that that is up and on there before I move forward. If somebody can just let me know that that you can see that.
Yes. We can see it, Jeff.
Thank you. So what I'm going to do is I'm going to cover some of the recent data that we're seeing in Boulder County relative to COVID-19. And then I want to walk us through the finalized indicator framework, which I presented to you a week or so ago. I think it was 2 weeks ago, actually, that was in draft at that point, and talk about what the measures are that are in that indicator framework. So we'll just start walking through this. The first slide that I want to show you here is the total number of newly reported cases by day. And what's important about this graph, the dark blue down here is non-CU students, and the light blue is CU students. So pretty easy to see here that we've got a situation where we've got a significant outbreak happening at the University of Colorado. And it's one that we absolutely need to get a handle on and are working diligently with CU, the city of Boulder, and the state of Colorado on trying to stop the spread of and control the spread from getting into the community. So those are the two goals that we have associated with this. What I want to point your attention to is that our normal cases down here, we are seeing a consistent trend in. So if you pulled this graph back to mid-July as an example, these case numbers that are dark, that are non-CU students, are on a pretty consistent trend of what we've seen over time. A little bit up, a little bit down, but the expansion and the spread is really contained to CU students here. I'm going to go through a couple more graphs after this next slide to demonstrate that some more. So this is our 5-day average of new cases, clearly demonstrating that we have a significant outbreak that's associated with CU that started here when school went back into place. We are not yet seeing a decline in those numbers, and we do expect, based on the 14-day quarantine letter that we issued, as well as some changes to policies at the university around disciplinary action and some increased patrols on the Hill, we do expect to see some decreases here in these cases. And we are talking about, if we don't see decreases, what are some of our next steps? But this is clearly a significant spread associated with CU. And we are seeing that spread, though, is contained to the University of Colorado at this point in the CU students specifically. I'm going to show you a couple data slides on that. So this is the 2-week cumulative incidence trend in Boulder County, and it's so looking at the age group from 0 to 30 plus. And if you look at this, the green line right there is the 18 to 19-year-olds, and this is the 18 to 22-year-olds. And when you look at the older population beyond that, down here, you're not seeing any indicated spread outside of this population. When we further broke that down and looked at it associated with non-CU students, we further saw that the spread is contained within the CU students that we have at this point. So the blue graph right here represents the 18 to 19, the orange, the 18 to 22 that are CU, and the green line, which is flat on the bottom there, is the 18 to 22 that are not CU students. So again, at this point, right now, we're not seeing generalized spread to the community. The other pieces I want to cover are a couple other indicators that we follow and that you're going to see in the framework, and that's our positivity rate. So our positivity rate has remained under 5% still. We are seeing a bit of an uptick in it right here. We are increasing, I think most people at this point, that we've increased testing in 2 places in the community. We have a drive-up site at Stasio Ball Fields, and we have a walk-up site that's up on the Hill. And both those sites are continuing to run between 250 and 400 tests a day. So we increased testing pretty significantly. The majority of the folks at the testing site up on the hill are our CU students, and we want those CU students to continue to use that testing site so that they don't have transportation, and they're getting tested so we know the status where they're at relative to having COVID or not. This next graph is our hospitalizations to date that are COVID-19 positive. And again, I think this is a continued good news for us, is that ever since the initial outbreak that we had back April, May, we've seen declining cases and stabilized hospitalizations. So as you look at this graph, it's a little bit of up and down, but it's staying relatively flat. This is actually consistent with what we see at the state health department as well. If you look at their hospitalizations across the state, the curve looks very familiar. We meet with our hospitals on a weekly basis. So as we look at the data that comes from the state database on this, we're also talking with our hospitals on a weekly basis and monitoring indicators, as well as talking with them directly so we can validate that what we're seeing in the graphs is what we're seeing on the ground as well. This is just a picture and snapshot of some surveillance that we do once a month relative to mask compliance. And what I wanted to just highlight here is that we have high mask compliance in our community, which is great. I want to thank the cities that also put out mask requirements ahead of the governor and at the same time or ahead of Boulder County Public Health. And also thank the governor for putting a mask order in place, because when that actually happened, we saw a pretty significant jump in the percent compliance and masking in our community. And it's just another indicator that people are wearing masks. For anybody that's listening to this, I want to tell you how much I appreciate that, because as you've heard me say before, the way that we best control this disease is by social distancing, masking, hand hygiene, and if we can be diligent on those things, then we can help control the spread of the disease. And this demonstrates that our community is doing that. I want to talk about the framework now. The guidelines that are pictured here and that incorporated the framework that I'm going to walk through were requested by superintendents back in the early part of the summer, when we were looking at planning for schools and needing to have guidelines in place. And there was none at the state level at that point. So the Metro Denver Partnership for Health, which is 7 other counties in the metro area, met with the superintendent across those and developed these guidelines, which we put in place to help schools think about how to get students back to school in a way that reduces risk. These guidelines also evaluated and reviewed by Public Health and Environment. And the guidelines are what incorporate this next set of framework I'm going to show you. So this first framework indicator, and these are, again, the same ones that I added to you a couple of weeks. This is finalized and in chart form with actual reads in it at this point. First one is case rates per 100,000 population. And if they're green, then we are recommending a in-person or hybrid. If it's in yellow, then we are recommending a hybrid or remote. And if it's in red, we are recommending a remote. And I want to talk through this because these are not mutually exclusive to each other. And the situation with CU is an important one to highlight relative to why we're supportive of the district's plans as they're moving forward right now. So first, let me just go through the numbers. So 373.1, obviously well above the 100. We are also tracking the level in Weld County and Broomfield County because we're partnering with our other public health agencies around us to make sure that as we're talking about school districts that cross jurisdictions, that we're aligned on the work that we're doing. And we are aligned. Each of these jurisdictions is providing data to us, and we're having conversations about what that data means, what it looks like, and where we're at in relation to the support of schools moving forward. The second indicator is the trend in case numbers per 100,000 in the past 2 weeks. And again, what we're looking at here is we've seen a uptake in trend of 279%. That's a significant uptake of our trend. And we know again that that is confined and at this point associated with those University of Colorado students and the spread of COVID in that population. The level in Broomfield County is green, and the level in Weld County is yellow. These indicators are two different indicators that we use in addition to those primary indicators. The first one is the first, I think I duplicated the slide. Oh, no, I didn't. The percent positivity rate. So this is what I just showed you before. And if we're at less than 5%, then we're in green. If we're at over 7%, we're in red. And our positivity rate right now is 3.5%. At the end of this, I'm going to actually have Emily Payne talk a little bit about this because we've had a lot of questions about our positivity rate. So I want to make sure I'm addressing that with folks who are listening in tonight. The current level in Weld is 3.8%, and the current level in Broomfield is 2.8%. And the positivity question is going to apply to all counties across the state when we get to that point. The two additional metrics that I wanted to talk about are we have trend and case rate numbers per 100,000 for our school age population, which is 5 to 17 years old. And we are in a green status for all of our 5 to 17-year-olds at this point. You can see 7.7 in Boulder, 9.5 in Weld, and 0% change in Broomfield. And the last indicator that's an additional indicator that we look at is the ability of the local public health agency to have capacity to do contact tracing and case investigation. So when we have an outbreak or we have an increase in cases, we actually have enough staff to be able to respond and control the disease. And in Boulder County, we're at 69% of our capacity to do that. Weld County is starting to collect this data for us, but hasn't yet sent it. And Broomfield County is at a green of 90%. I do want to say here that the ability for us to follow up on case investigations and contact tracing associated with the Broomfield or the University of Colorado outbreak, we actually are handling that, and that's because we have CDPHE, the State Health Department, helping us with that case and contact investigations, as well as the partnership that we set up with CU on the front end before school came back, which was to put in place case investigators and contact tracers at CU specifically. So between the CU case contact tracers and investigators, the State Health Department case contact tracers and case investigators, and our own, we're able to respond to all the cases that we're seeing at this point. We also have the ability to pull mutual aid in from our other surrounding local public health agency jurisdictions, and they would have the same to do for us if they were having an outbreak as well. We haven't had to initiate that yet, but we do have that ability. I want to talk about the additional considerations in terms of conversations that we have in addition to those indicators that you saw. As you saw in the earlier data, we definitely look at numbers of hospitalizations. We want to know if our hospitalizations are increasing, if we're seeing spread transition from, as an example, in the CU situation, into the older age population, where we know we have higher impacts associated with hospitalizations. And again, we're not seeing that at this point. We also are going to be looking at district testing results. I know both Boulder Valley and St. Vrain Valley school districts are implementing that, I believe. So we'll be looking at those results. I just talked about the community-wide spread, and to determine if that spread is staying contained or if we're starting to see more geographic spread in our community. In addition, we have a lot of private schools, as I think you're all aware, that have been operating and are doing great. Many of the private schools are smaller, have the ability to really establish and sustain the types of controls that we're looking for to help minimize the spread of the disease. And then the last two things are the ability to cohort or maintain social distancing, which Boulder Valley School District is doing with this plan that they've put forth, and availability of test turnaround time for results. When I was presenting maybe a month ago to you all, or maybe a little more than that, 2 months ago, we were having some concerns at that point with test turnaround time and being able to get results back quickly. That issue has been solved. We have test turnaround times coming back in less than 3 days. The state has developed capacity and has backup labs, and we have the ability now to turn around tests much more quickly, and that even includes with the expanded capacity and testing that we're doing in our own community right now. So that's my last slide, and what I want to do is just make sure that two things. Number one, if Emily Payne, who's my epidemiologist and data specialist, could talk about the percent positivity rate, I would appreciate that. And then if I would like to also offer the opportunity for Chris or Soda or Heather to add any other pieces that they want to emphasize. Heather and Soda are the ones on the ground doing the detailed work with the districts, working through the plans, and have been working really closely with our schools from the very beginning. So I'll stop there.
Thanks, Jeff. Yep, I'd love to talk about the percent positivity and what we're kind of finding with our data sets on testing. So you all are aware, we get our testing data from what's called electronic lab reporting. And that's a data system that is set up by the state health department, and it's being used both by the state health department and all local public health agencies to look at data on testing positivity over time, the number of tests being performed each day, and other indicators like that that we have to monitor and report back to the state on. So one thing you should all know about the electronic lab reporting data set is that it actually does not include every single lab. It includes, for Boulder, it includes our different hospital labs, including Boulder Community Health and Boulder Community Hospital, Longmont United, Longs Peak, et cetera. And it does also include our new community testing site. I've seen that data start flowing in over the past few days, and it's really helping, I think, to help make the data set even more representative. But one big caveat we should mention is that that data set doesn't currently include the tests conducted at CU Wardenburg itself. So tests among CU students that are conducted, and many are conducted actually, a full third at least, and likely more now that we're doing the community testing site, are conducted outside. So we're not missing all the student tests, but unfortunately, we haven't yet gotten the Wardenburg lab to be able to report through this electronic lab reporting system. But because we all really recognize this is extremely important, because this metric is being used not only for our internal things, for these school metrics, but also for the statewide dial I'm sure you all have heard of. The state is working really closely with CU on getting the system up and running so that they will be part of the electronic lab reporting system. And I haven't received an exact date on that, but they are working very diligently and giving updates daily on their progress with that. So I think that we just need to be very cognizant that yes, this data set might not have every single test that's conducted, but it absolutely is the best data set we have, and it is consistent. So if we think back, like Jeff showed the graph, we have seen a very significant decline in our percent positivity. This caveat has been in place that entire time. So what we're seeing in terms of trend is real. We might know that we are missing some, but I think that we have a good picture and really the best picture we can get given the data sets we do have. We've also included some language on our website to help make this really clear to folks. And we spoke with the state late last week as well to ensure that they include some more information so that the community doesn't feel like they're being misled. We're certainly not intending to mislead anybody with our data, and we want to be as transparent and as clear as possible. So I think that's all I have, unless, Jeff, there was anything I didn't touch on you wanted me to?
I think that's good. I would love to offer, Rob, if you don't mind, an opportunity for Soda, Heather, or Chris to comment.
Rob, can I say a few words?
Absolutely, Dr. Bina.
Thank you. I just wanted to emphasize a couple of points that Jeff made, because I think it's important that the board, the public, and you, Dr. Anderson, understand that we're taking this outbreak at CU very seriously. We are working closely with our partners at the city and at CU Boulder, as well as the state health department, to try to test, contain, and isolate those kids, those college students that are infected, that we're watching very closely the data, so that we're watching to see if there's impact and spread throughout the entire community. So you can be assured that as we move forward, we're going to be working closely with our partners to contain this outbreak, but also to monitor it to make sure it doesn't infect or doesn't affect other people in the community.
Thank you.
Jeff, if there's anybody else who'd like to speak, we'd certainly give them that opportunity at this point in time. If not, we'll end this presentation and turn it over to Board President for questions.
Looks like we're good.
Okay, great. Thanks so much for all of this information. So let's give an opportunity for board members to ask questions. Who would like to start? Kitty?
So thank you for sharing all of that. And I'm a little bit confused as to at what point would we have to not have the kids in school, because there are several different indicators. And if we're not in the same color on each of them, how many have to be yellow or green for us to go forward, and how many of them have to be yellow or red for us to pull back and keep the kids out? And I noticed that we had, what, 2 greens, 1 yellow, and I can't remember, 2 or 3 reds. So I have questions about that too.
Yeah, absolutely. So I think, let me give you a comparison, and then I would ask anybody else on our team to jump in and add to this. But again, with the fact that we have this, at this point, contained to CU, we know that we have kids that are both in very difficult situations at home, parents in very difficult situations at home. We are not seeing generalized spread in the community, and we know how important it is to get kids back. I know you all know that. And when we look at this data and we see that it's contained to CU, we believe that that is not creating excessive risk in our community. I can tell you that, just as Chris said, we're looking at that data every single day. We're paying attention to it. If I start to see cases associated with CU students spreading into the community, and we start to learn that through our case investigations, then I would be sharing that information with Rob and Don, both of our districts. We would be talking with the state health department about that and making sure that they're aware of it. And we would be considering, at what point do we feel like this becomes too much of an issue or too much of a risk for us to continue. What we don't want to do is we really don't want to see cases get into our population that's at higher risk. And then we end up seeing more hospitalizations and potential higher acute outcomes associated with that. So we're really watching the data carefully, but we haven't seen indication of community spread at this point. And that's the first thing that would start to have us start to question, where are we at? When do we feel like we need to pull back? What are we seeing in the community? What's happening? Is this isolated or broad spread? So Chris or Soda or any of my team, anything to add to that?
I think I would just echo what you said there, Jeff. Ideally, for completely in person, it'd be great to see everything in the green. For hybrid, as sort of what's being discussed is some students back, we're talking about everything being in the yellow. And because we know that this outbreak that's happening currently, the situation has been contained really to a specific population. Although, like you pointed out, there are some of our indicators in the red, as Jeff said, until that if that were to move out into broader community spread, that would have impacts. But at this point, unfortunately, with these metrics, it's not as simple as, okay, this one's in this color, that means this. And so it's a lot of evaluation and consideration.
So it sounds like what you all are saying is that the red is largely due to cases at CU, correct?
Correct.
Thank you.